Hello, my name is Gillian Au and I'm the Medical Director at Trinity Hospice and Palliative Care Services. At Trinity, we're all about caring for our local community and enabling compassionate care on the journey to end of life. Sadly, we know that in this current really difficult and challenging coronavirus pandemic, it's bringing with it hardships and excess deaths right across the world, in our communities, and touching many of us as individuals in so many ways. This pandemic has changed how we live and how we die. We associate palliative care with reaching out and connecting with the people and the families and what matters most to them and through the hardest times that we all face. This is so much more difficult right now with the isolating nature of this condition, but we're adapting to it to do our very best and to stay true to our core values. I'd like to tell you something about how Trinity has been changing and adapting to this challenge over the last few weeks. Due to social distancing rules, we've currently lost the vast majority of our amazing regular army of volunteers, so key to the day-to-day functioning of our organisation in normal times. And also in the past weeks, due to staff or family member illnesses, we've been down on average about 12 to 15% of our regular staff numbers. The vast majority of our non-clinical staff are working from home, and many of our fundraising staff have been redeployed to help us with the key communications that we need, administrative functions and technical support. In adapting to this challenge and the social distancing rules early on that we had to make some very difficult decisions. We suspended all of our normal teaching and training activities and also the face-to-face care through our day therapy unit, psychology, lymphedema and Linden Centre counselling services. Wherever possible though, we've continued to support all of these patients through telephone and video communications. We also had to make some very hard decisions about restricting visiting to minimise the risk of transmission of this infection to all our patients and staff. We're supporting our patients as much as possible to keep in touch with their loved ones through virtual technology. We've increased the inpatient unit capacity up from 18 to 28 beds to support the rapid discharge of frail elderly patients at end of life from Blackpool Victoria Hospital. This is in addition to continuing to support patients in our local community with the most complex palliative care needs who come into our hospice for support. We've increased the medical support to our community service and are now providing a 24/7 advice line for our GPs and community colleagues, and have developed community and care home palliative care guidance for the care and symptoms relief and end-of-life care of patients suffering from COVID-19. We've established a dedicated virtual support service for all our Fylde Coast GPs and our care home staff, and are providing access to expert palliative care support for all patients in their care when they need it. Our community team is also providing specialist palliative care education and support into the Harbour facility in Blackpool and Clifton Hospital, and are also supporting the homeless population on the Fylde Coast. Our hospice at home and community clinical nurse specialists are seeing increasing numbers of patients, including those with COVID-19 out in the community, and we're working very closely with our local out of hours and community nursing services, particularly overnight where they're co-located with the Fylde Coast district nursing teams. Our large skilled hospital palliative care team is on the front line supporting NHS colleagues at Blackpool teaching hospitals. They're reaching into all of the wards with educational support and hands-on support to ensure the compassionate care of as many patients as possible approaching end of life. Our Linden Centre counselling services have been working very hard with our hospital and chaplaincy service colleagues to develop bereavement support for our whole community, including providing much needed pastoral advice and support for our NHS and social care staff. With the support of our amazing volunteer community, we've been able to establish a buddying system for our vulnerable volunteers and patients who have been shielded or are self-isolating. Our Brian House Children's Hospice normally offers day and respite care for the very many children with life-threatening and life-limiting conditions and their families in our local community. With the recent emergency government guidance, many of these vulnerable children are now having to be shielded at home, but we have continued to offer respite care and support for the very most vulnerable and those who need to be removed from home due to COVID-19 infection in their household. We also continue to remain ready to admit and support end-of-life care for any child and family in need. We're prepared to use Bryan House facilities to increase our capacities for care for more adults at end of life should this be needed. Across the country, we've all struggled to get sufficient supplies of personal protective equipment to ensure the safety of our patients and staff. We've been really grateful for all the support of our partner organisations and the generous and creative responses we've had from our donors to the recent online appeal. There is no roadmap to guide us through this crisis. We are all working together to do our very best. At no time have Trinity's core values been more evident. We are caring, we're adapting, we're responding, we're excelling, and we're socially engaged with our partners and in the local community in facing this crisis more so than ever before. We have an amazing workforce of multidisciplinary professionals committed to the care of our patients, and we'll need to draw on all of our skills, knowledge and energy over the coming months to care through such unprecedented times. We're all working in unfamiliar emotional territory now. There's no doubt about this, and there's understandable fear and anxiety around us all. This is going to be a long haul, and we're all going to get through it together through kindness and compassion for ourselves and for each other in order to stay resilient. Finally, I want to just say a huge thank you to all those at home in lockdown, all of our amazing clinical teams that I've mentioned, but also remembering all the support staff in administration, in fundraising, catering, IT and housekeeping roles, who are all working tirelessly around us to keep us all safe and up and running at Trinity and all the services that we provide. Please stay safe, and thank you all for caring.